Christopher.
Hi.
How are you today?
Not well.
Oh, I'm very sorry to hear that. I know we've been seeing each other weekly, but I'm still going to introduce myself. My name is Jessica, and I'm going to be your nurse today.
Perfect.
Can you tell me your first and last name and your birth date?
Christopher Simmons, August 2nd, 1987.
Thank you. So, tell me what's going on.
Well, I have had a sore throat, but it's getting a little better. Runny nose, fatigue, and my mucus has been discolored, green, yellow.
Okay. How long has this been going on for?
About a week.
Okay. All right. Any fever?
No fever.
Okay. Are you having any difficulty breathing?
I've been coughing and wheezing a little.
Okay. All right. Well, I'm just going to take a look at you, and I'm going to listen to your heart and your lungs. I'm going to look at your ears. How are your ears feeling?
They feel a little full.
Okay. All right. So I'm going to go ahead and take a look at you. You look like you're breathing at a normal rate, but I can tell that you're struggling a little bit. I can hear you wheezing a little bit from here. Okay. And then that drainage, is it nasal drainage?
Yeah.
Okay. Are you coughing anything up?
No, not yet.
Okay. All right. So I'm going to take your pulse. Good. We have a pulse of 80. Respiratory rate about 22. Your chest seems to be moving symmetrically, which is great. Both sides are rising and falling at the same time. And I don't really see any use of accessory muscles while you're breathing, which is also a very good thing. So I'm going to go ahead and take a listen to your lungs, okay? Deep breath. Good. Take a listen to your back. Okay. 2 more. I know this is kind of hard with your symptoms. Okay. So I can definitely hear a wheeze in both upper lobes. So it doesn't sound like it's too deep yet, and we want to avoid that for sure. I am also going to just take a listen to your heart just to make sure everything's fine. So just breathe normal. Good. I hear normal S1, S2 sounds, no murmurs. I'm going to go ahead and go over some heart sounds and valves. This is your aortic, pulmonic, Erb's point, tricuspid, and mitral. Good. Both of those sound normal. Good. All right. So I'm just going to take a look at you. So it looks like your eyes look normal to me. I don't see any redness in your conjunctiva. and your sclera is white. You do look tired, fatigued. Um, and then you said your ears are feeling full. So I'm going to go ahead and take a look in your ears. Okay. Okay. So, your ears definitely look like they have some fluid behind your tympanic membrane, um, but it doesn't look like they're infected or red. So I can see why they feel full, but they're not really painful or hurting. Okay, so that's okay. Um, the ears are normal in shape and symmetry. The color and position is normal for my patient. And there are no deformities, lesions on either ear or mastoid area. Okay, so there is a moderate amount of cerumen. There's no discharge, no foreign bodies or lesions, like I said. And then, so we're going to take a look at your nose. Your nose looks completely normal. I know that you've had a lot of nasal discharge. You said green and yellow. So, do you have any tenderness in your nose?
No.
Okay. All right. And then I want you to plug one side, breathe out of one nostril. Okay. And then the other side. Okay. So both seem patent. Did you take any medication today?
Yeah. I took some Mucinex. It helped for a little, but not really.
All right, so it looks like your nasal passages are patent for right now, which means they're open. You're able to breathe through both of your nostrils, which is great, which probably the Mucinex really helped you there, thin out your mucus. And then I just want to kind of palpate your sinuses. So we have your frontal sinuses up here. We have some maxillary sinuses here. There is no swelling. Do you have any pain in your sinuses? No? Okay. And then I'm going to take a look at your throat and neck. If you could put your head up for me. Good. And then go ahead and swallow. Good. So throat is symmetrical. Your trachea is midline. I don't see any jugular venous distension or swelling or deviation. I will go over your lymph nodes. So we have your pre-auricular lymph nodes. I do feel them. They do feel a little enlarged. And then post-auricle, we have your occipital back here, sternocleidomastoid, submandibular. You can feel those too. And then anterior lymph nodes, we have your cervical lymph nodes, and supraclavicular, which I do not feel. Okay. And I'm going to go ahead and take a look in your mouth. If you could open your mouth for me, I want to take a look at the back of your throat. You can say, ah. Good. Uvula is normal. It does rise when he says ah. There is some redness in the back of your throat, which is probably why it's sore. And it might just be from all that drainage that you're having. So I don't see any other abnormalities other than the redness. And then you still have your tonsils, correct? Okay. Let me take a look at those. You give me one more. Okay, so tonsils are enlarged on both sides, which is probably just a reaction to your upper respiratory infection, which is what you have. So for the wheezing, I'm definitely going to give you an albuterol inhaler to dilate those airways. You can use it every like 4 to 6 hours, 1 to 2 puffs. Have you ever used an inhaler before?
No.
Okay. So I can have, we'll have someone bring one in and I can teach you how to use it. And then I might even give you some short-term steroids, maybe a Z-Pack, um, for antibiotics and some prednisone for you to taper down. So the prednisone, you can take over like a 5-day period. It'll give you the instructions on the packet. The first day you take like all 6 pills at like different times. And then by the end of the 5 days, you're only going to take 1 pill. So you taper down. And I really think that that should take care of things for you. And then maybe stay on the Mucinex, try to thin out those secretions and get them out. Okay, we don't want them to settle in your chest.
Perfect.
Okay. Do you have any questions for me?
No, I'm good. Thank you.
You're welcome. All right. Well, I hope you do well, and I won't see you next week.
Thank God.
It was nice seeing you.
Lovely seeing you.